we always want to be perfect, that one step better. So we just keep working and working, and that's what I really like about it.
Jacqueline Giannet is a ballerina. She started at the Scottsdale School of Ballet when she was 5 years old.
I want to take dancing to another level and be a professional because I can't imagine not dancing.
The 15-year-old definitely works hard to perfect her craft. She practices 6 times a week.
I'm known as the ballerina, and when that's your life and all of a sudden you can't do it because like something's hurting, and then first of all you want to keep doing it but you can't, and that was just really hard. Kind of almost felt like tendinitis, where there was swelling and just major discomfort when I went on pointe.
Dr. Jason Lake with OrthoArizona found that Jacqueline was suffering from something much different than tendinitis in her right ankle.
She had 2 things. She had something called posterior ankle impingement, or posterior hindfoot impingement. So she was getting pinching of tissue in the back of the ankle. She also had something called an os trigonum, which is a little extra bone that some people have in the back of their ankle, which most of us never even know we have it, unless you're a high-end ballet dancer that goes on pointe routinely.
The pain eventually got so bad that she couldn't even dance. While resting the ankle and icing brought some relief, it was not long-term.
I kind of wanted them to think about how bad this was and how important ballet was to her. Because I knew that if she wanted to continue to do ballet, if we didn't remove the bone, she was going to have a hard time doing so.
He definitely listened to me, especially when I was really, really worried about having the surgery and all the side effects that came with it.
Dr. Lake arthroscopically removed the extra scar tissue and that little extra bone in Jacqueline's right ankle last February.
We put her in a splint for about a week just for comfort. And once we were sure she was comfortable, we switched her to a walking boot. She wore that for a few weeks until she felt more comfortable, and then eventually she weaned out of the boot. She went through a course of physical therapy, and after 6 or 8 weeks, as she felt strong, she started getting and transitioning back towards ballet.
I was very nervous because I knew from taking breaks before how much muscle you can lose and how much out of shape I knew I was. And that was definitely a little bit nerve-wracking, but it's gotten a lot better.
A lot better that Jacqueline will be performing in her dance studio's performance of the Nutcracker this December.
The goal is to do everything we can to get them back to what they were doing before.
I'm going to be so happy. You know, being back on stage means the world to me.